Thank you so much for making the time to meet with us today.
Pleasure.
So let's just start with maybe you guys can introduce yourself and then also speak about what exactly MACQUARIE Medical Care does.
Okay, I'll start. I'm Dr. Armid Azadeh, and I'm the founder and medical director of MACQUARIE Medical Care. And essentially what we do is we provide health in reach by using telemedicine and digital health innovation. That's our elevator speech.
All right, so my name is Tosaline. I'm the response coordinator, mainly dealing with the case management of different patients at our lodges.
Okay, so what exactly does that mean?
So when I got back to Namibia in around 2010 and 11, I started to visit some remote parts of the country. And what we noticed is that a lot of employees at lodges and things like that, or remote sites, they had no access to care. So I started wondering, where are guests at these lodges going to, if they fall ill, what happens to them? And if the staff fall ill, what do they do? So initially we just started with providing a doctor on call, essentially. So they would call whenever they needed a bit of advice or assistance with some illness. And very quickly after that, we sort of developed a full service model where we actually have electronic medical records for every individual, so we know exactly who they are, what their issues may be. We have a response center, which Tosaline is sort of coordinates, where we can channel all the phone calls coming in, and then also the coordination of putting medication on site, so we're able to actually treat people on site. And that's how we've sort of decentralized healthcare to reach individuals in remote areas.
Okay, so when you say we, who is we? Are there like other doctors within? What does a team look like? I think that's the question.
So at the moment, we're just a team of 3, consisting of Dr. Armid, myself, and my colleague Pendu, who's more on the operation side of stuff. So yeah, that's the team on in-house.
Yeah, so that's our full-time team, but
yeah.
What we're doing is, the more volume we get, the more we contract doctors in to cover the phone lines. So next week, for example, we have a locum doctor who will cover for phone calls and response from a medical side. We're also supported by a team of advisors. So we have 4 advisors who are helping us grow a network and lobby the kind of business that we're doing.
How effective has it been so far? Because I definitely understand the struggle that you're talking about, because even as we have traveled through different countries, whenever someone helps us on the road or we meet like a guard or something or a staff, they'll always ask us, do you have any medicine? My wife is sick or XYZ. So I totally understand that, and we've seen it. And I'm just wondering, like, how easy has it been to get from the time that someone calls you and you realize that, okay, this person is sick and we need to get there? How effective has that been, or how has it worked out?
So telemedicine really is treating from a distance.
Okay.
So we're looking at treating from a distance.
Mm-hmm.
And the majority of calls that we get, we're able to treat maybe 80% of them with medicine that we already have put on site. Okay, so we put a box of medicine on site, and we've strategically looked at what are the illnesses that are in that area, what are the risks that they face, and it's mostly for primary healthcare issues, stomach bugs, flus, headaches, skin rashes, things like that. And so we put medicine there to treat those conditions mostly. So a simple phone call, consulting with the doctor can often sort of look after that condition that the patient has. We also have expanded to sort of traveling groups such as yourselves, for example. So we have tour groups that tourists who are going into remote sites, and they also like to take a box of some medicine and just having that comfort or that peace of mind that they can call a doctor when they're in the middle of nowhere and they're not sure what to do. When it comes to that risk management, and we see that this is something that is either persisting or is more serious than we think or than they think, then we usually escalate it, and that's really where Tosaline comes with sort of response as case management, where we may need to refer on to do further tests or see a doctor and knowing the geography, we can then say, okay, we do know this doctor here, we can get a good report back from them. Let's send you to this doctor in this town, for instance.
Pretty much.
Okay. What did the research phase look like? How did you figure out what specific ailments that people have in that area?
So when we started in 2012 with sort of a pilot project, looking at initially with 2 lodges in the north and the south of the country, over those next 4 years, we got a lot of experience and just did a lot of data capturing of what are the types of illnesses that in the lodge environment they're getting. So we generated that, and we sort of that gave us a lot of ideas of what to refine the kind of medicines and the quantities that they needed on site. And so then thereafter we sort of tried to expand it, and we did. So we moved on to sort of 4 lodges, then 5 lodges, then 6 lodges, and then individual sort of cover. So looking at the individuals, not just whoever's on site, but looking at every individual, what their needs may be. So we started expanding it to look after those who need high blood pressure or HIV medication, asthma medication, all of their chronic needs as well. And that's really what Tosaline's been spending the last few months with, is really looking at what are the chronic medication needs and getting them out to them on a monthly basis. Because what happens actually is, the way they would access care previously is they'd have to spend a day or 2, even 3 days going off to the closest clinic, waiting in line. Sometimes the doctor's not there, seeing a nurse, sometimes the medication's out of stock. So essentially it just really took a lot out of their productivity, and the efficiency on site is with having to sort of negotiate the existing health infrastructure, which is very poor. So this has really solved a lot of those issues.
What kind of partnerships or, I don't know, contracts are in place for you to be able to provide the different types of medicine?
So we have partnerships with medical insurances, because what we found is it's fine, we can look after the primary healthcare need of an individual, but when they need to be hospitalized, or if there's something more severe, then we're still having to rely on the sort of the existing state infrastructure. So what we decided to do is try and look for an insurance company that could complement our product offering, and we found that, fortunately, to sort of customize an insurance product to then look after those what-if needs. So we got that in place, and that really helped us. And then the other sort of partnerships that are working quite well is with the Hospitality Association of Namibia. They like our product for the tourism sector, and so they're starting to promote this to all the different companies out there.
What about all the other products that you are offering on the website? Because I saw quite a few and I was like, wow, how are you doing all of that? How big must your team be, right? Because you have the telemedicine, of course, that's the healthcare. Then you have medical supplies, the first aid kits and protective equipment and so on. And then there's health and safety. I think you also do a bunch of training and public health and so on. Maybe let's talk a bit more about that.
So the medical supplies are basically the ones that we provide to the different lodges, of which the lodges or the lodge owners have to then purchase for their staff members, and then which is kept for the staff in order for us, when we do prescribe any medication, it's coded medication. Like you said, it's over-the-counter medication that anybody can get, that is or can be prescribed right there and then, and then they have access to it, or a supervisor or a manager has access to it to give it over to whichever staff member has a need for it. But then they don't get access to it just as is. They need to have spoken to the doctor and have some type of written prescription, be it by SMS or via email, that we send through to the lodge manager, that they can then dispense to the staff member that is in need of the product and so on.
So from a health and safety side, every lodge needs to have just basic first aid kits as well. So we also have provided that for our clients. And then in terms of checkups and some signage that they need, we've also done that for lodges. It's not a lot of work, and we've actually outsourced most of the health and safety work to other providers to do that for us. would try to sort of look after all of these health and safety and medical health needs of a client. So we would, everything does tend to go through us. So that's why we provide the first aid, the training as well. Then the health and safety people and trainers will come in and do the training. Okay. Sometimes there's other medical supplies needed. We run certain programs to go and do contraceptives or health information on site, and so we also help with arranging and setting those up. From the public health point of view, my training is also in public health, so I always look at what's happening on site. Why are people falling ill? So that's what's great about the electronic medical record, and the app is what you sort of mentioned, is when we're providing the day-to-day needs for staff members, we start to pick up that there's a lot of flus or there's a lot of gastro, so you start to see outbreaks sort of happening in real time. And with that, you can actually start to proactively, start to advise people to wash their hands more readily, or speak to management to look at, the hygiene at the living quarters and things like that. So we can start to, proactively diminish or look at health or disease burdens or diseases that are impacting on them, rather than just letting it run its course.
I would be very curious as to both of yours background story, your medical journey. Mm-hmm. Did you always want to be a doctor and so on? And of course, Tosaline, how you got into the coordination, if it was always in medicine or if it was in other things?
As for myself, I was never really into the medical aid or medical field. I was more into hospitality. From the time that I started working, I started working with the Hilton and then first as a waiter, and then the Hilton, and then the Protea hotels. So pretty much more hospitality than medical stuff. I got into the company about a year ago. Very new. But I'm passionate about it because it still has to do with people, and I love assisting people. I love working with people. So it gives me an opportunity to still get around with people and, help solve whatever issues they're going through, relieve them from the pain, the stress that they're going through. It's quite pleasant and satisfying to deal with people, actually. So, yeah.
Yeah, so my side, I don't know when I first thought of becoming a doctor, but I am the first medical doctor in my family and extended family. They're dentists apparently, but engineers but no medical doctors. So I studied medicine, but I always wanted to do something a little bit more. So after that, working for a few years, I decided let me go and specialize in public health. So I went and studied public health, and really the difference between clinical medicine and public health is public health looks at populations and health systems and asks the question, looking a lot of at the data and statistics, and is the system actually meeting the needs of the population? So it always, I think that may have triggered the idea of looking at, growing up in Namibia, I know exactly what's going on around the country. So with that experience, it sort of opened up new ideas of how do we solve these problems. And that may have sort of led us down this road. I was fortunate enough to work in different parts of the world, which also gave me a good understanding of different solutions and systems around the world. I worked in West Africa for a couple of years, and Southeast Asia for 2 years, and then I went and did my master's in the US. So I was there for another 2 years, and then we sort of came back. So it's given me a good overview of the global health situation, and then finding solutions for Namibia, where we're at now.
What was the process, or like concrete steps from seeing the problem, like being at this lodge, and then moving into like actual implementation and actualization? What does that look like? Because people go on trips all the time, doctor, and not everyone comes up with a business idea and goes into it and a business that's actually helping people.
I think that's the challenge for anyone who has an idea. Ideas, they say, are cheap, but to actually implement them and make a real business case out of it and set up a company and get it working. It's been a challenge, and that's I think why it's taken us this long to get to where we are. It's just balancing, normal responsibilities of daily life, the risks involved with sort of starting something new, and then a lot of the barriers and pushback that one gets when you try and do something new. So I think Namibia, in essence, generally is a bit of a conservative, small country. So any new innovative ideas always takes a bit of time to really take hold. But most people we talk to, in fact everyone we talk to, really can see the value in what we're doing. But then translating it into actually implementing business processes and things like that takes a while, and it can take a bit of time. So we started with just finding solutions for those individuals, very ad hoc, and I carried on doing other things. I never thought it was actually going to be a business in the first few years. It was just helping out lodges and it was giving me a chance to go and visit these lodges. So it was a nice thing to do at the same time. But we very quickly realized that it had a massive role to play in people's lives and in providing meaningful solutions. So we decided to just formalize it and build on it. And now we're looking at actually scaling. So very recently we were chosen as sort of the startup of the year for Namibia. Mm-hmm. So we were selected by Seed Stars, and now I'll be going to Johannesburg next week actually to present at the African Summit, our business essentially, and see if there are any investors who are interested in scaling this across more sectors of Namibia, which is what we anticipate is the next step. I mean, we've only really touched a small proportion of the tourism sector, but there are many other sectors where these solutions would make sense. And that's just for this country there. I think other Southern African countries and other African countries really do have the same challenges.
Oh, congratulations on your win.
Thank you.
Thanks.
Having said all that, what was your family's reaction or your friends' reaction, and what kind of support did you have?
So my parents are both retired, but they've always been supportive. They've never been risk takers, so they're not the entrepreneurs themselves. But I think I found inspiration through friends and my brother, who's also started multiple companies. So that entrepreneurial spirit I've been surrounded by it. Probably learned a lot from my friends who started companies in Southeast Asia and the US, etc. And just was inspired to not follow the status quo of just being a normal, regular doctor, seeing that patient in front of you, but rather look at doing some things a little bit more innovatively and impact a larger proportion of the population.
Thank you so much for sharing. I'm very curious and interested about the business case, and since this is such a huge challenge across the continent, how would someone that is interested in telemedicine, how would they start something like this, for example, in Ghana, in Nigeria? How would you recommend a young person to go about entering this field and bringing this kind of solution to remote areas?
I think through my research and reading a lot about over the years where telemedicine is on the continent, the WHO actually did a very good study in 2010 about the state of telemedicine across the world, and they did a lot of case studies in countries where it's successful. And then they also published something specifically about the barriers to telemedicine, and the biggest one is cost and then infrastructure. And Africa, where telemedicine is the least developed, those are bigger barriers to telemedicine. And to me, telemedicine is always something that had a lot of promise in terms of decreasing the cost of healthcare and increasing the accessibility, and also maintaining quality of healthcare. Really, it can balance all three of those central pillars. So why would cost be the biggest barrier in Africa? And I think that's because a lot of the telemedicine products or processes and pilots, that there have been many pilots in Africa, A lot of them have never looked at a sustainable model. They've been just pilot studies with grant money or something thrown in, and also by possibly foreign companies that don't necessarily know the realities of the African situation and the finances in Africa. So we really took it to the bare essentials of what telemedicine is, and that's just having a conversation between a patient and a doctor, and how can we enable that. Luckily Africa's got a very good cell phone penetration, so almost everyone has a cell phone, and data connections are getting more and more widespread, so it's much easier to communicate with everyone. So what I would say is, for that budding entrepreneur, is really look at the legislation. I think a lot of countries are starting to have telemedicine policies and e-health policies. Look at that state of the country and get involved in that conversation, because in many ways Africa is a little bit further back. Telemedicine is a common form of practicing health in North America, Europe. Germany has telemedicine kiosks all around. Switzerland, same thing. So why would it not be more in Africa, where we have even less healthcare workers and a poor health infrastructure? So the main thing is look at the finances, the business model of it, the revenue model, and then actual use case, who's going to be using it, and start. And usually when you start, you'll see it should snowball and progress. Yeah.
Can we speak a bit more about the business model?
Sure.
Because I'd be very curious in how the lodges or the patients pay. Is it like a monthly retainer that they pay for general access to doctors, or is it on a per case basis, or how does it work, and what did you figure out?
So that's one of the changes and innovative things we did. Probably not unique, but in this part of the world, medicine and healthcare generally is on a fee-for-service model, right? So every time you see your doctor, or every test you do, every medicine and pill you take, there's a fee associated with that. And the problem, in my opinion, and I think in general a lot of public health perspectives, is that is one of the big drivers for inflation, healthcare inflation. Across the world, generally healthcare is getting more and more expensive. Either it's because we're living longer and our diseases are becoming more complex, or our technology is more high tech and things are becoming more expensive. But why should basic things be becoming more expensive as well? So it's really looking at what is the incentive model. So the problem with the fee for service is that it incentivizes more services, right? Because it's a fee for the service. So we don't charge a fee for service. We're looking at a subscription model or a capitation model. So it's a flat fee for full access. So we as a company it's in our best interest to keep you as healthy as possible, so you don't need to call us as often. So we've kind of flipped the script, and that's really one of the innovations in this, especially in this economy or this healthcare space, is to charge a flat retainer subscription model fee for access to our platform and services.
And you charge that to the lodges, to the B2B partners essentially that you work with?
Exactly. So at this stage we're a B2B model, looking at companies that want to provide health to their employees, which ultimately is improving their efficiency at the workplace and is actually saving them because of healthcare and poor absenteeism and presenteeism related costs.
And it's also better for you to market, because once you have one off-taker, basically a business, then you reach all the people that are associated with that business directly.
Exactly.
And makes it more predictable for you as well, because you know how much revenue will be there and you have a more predictable business case. I would say.
Exactly. So we can look at the resources needed for every step in our business uptake or our membership uptake, and so it is a lot more predictable, and we can manage the cost infrastructure and our expense model much better. A B2C, which is ultimately where we'd like to go, like a consumer business, is a lot more complicated. It requires a lot more support staff, from finance, how everyone's membership is paid there, from their IT support, etc. So there's a lot more costs, and it'll push up the price. So that is something that we think that once we have the scale in the B2B realm, we can start to look at B2C models.
It's interesting, and maybe you can use the hubs, kind of the lodges that you have, also as a basic infrastructure that is already in place. So you don't have to develop into the nothing, although you don't have the request demand yet by the B2C. Mm. You mentioned that besides tourism, there are many other industries or sectors for which telemedicine could be interesting. Mm-hmm. What do you have in mind, and who would that be?
So essentially, it's anyone who has limited access, right, to quality, affordable healthcare, right? So in the most obvious case, it's geographical access. So people who are in remote sites. So all of that's why lodges are always generally remote. But you're talking about mines, farms, truck drivers who are on long roads, for example, offshore vessels. So these are the immediate sort of target sectors that we're looking at. But then you also look at normal industry. So whether it's manufacturing or whatever type of industry, they often have factory workers. And a lot of them also don't have access, either from an affordability point of view, and then obviously the quality side, to healthcare services. So they may also find the convenience of having a telemedicine service at the workplace, keeping them more productive at the workplace. So, and that could be in an urban and a peri-urban or even a rural environment. So I do feel that telemedicine, and in our model, should work and solve a lot of healthcare issues, even in urban areas. So that is our next phase of growth. And we are starting to engage with some companies who are already very interested in urban areas in what we do.
I must say I really like your approach to launching this, to really look at the 80-20. What are the things that happen regularly? What's the most common and the low-hanging fruits, let me say, and helping people feel better and being healthier, and then solving that with just depositing the medicines that are regularly needed in these areas. I really, really like it, and I think this could be relatively easy entry in at least testing how this could work in other regions as well, and providing these services. So really love that. Thanks for sharing.
My pleasure.
My question would be, for you as a business right now, if you could partner with anyone, who would you like to partner with, and what would you ask them for?
I think we have so from a software development side, because one of the important parts to having a good telemedicine model is having good data and good electronic medical records. And these online electronic medical records there are many of them. But what we did is we designed our own, because we wanted one that our doctors would use. And that's one of the biggest challenges globally, is that doctors don't like to use software in general, and definitely not software that makes their life more complicated. So we took it back down to our own software that we developed. And it's at the stage now where it's sort of a minimum viable product. We have an MVP, or a high fidelity prototype. So we need a lot more investment in getting that. And that's what we're essentially engaging with investors for. But beyond that, which is sort of investment into our internal processes, we're looking at distribution channels, because that is how we would grow. And we've kept very lean. We've bootstrapped thus far. It's all self-funded, and we've gotten this far by ourselves. But it's looking at bringing in the right strategic partners with sort of who can look at scaling this across border. In Namibia itself, I think we would grow, but it's across border really that we're looking at those kind of partners to find those channels, and there are various ideas of how to distribute something like this, that we would work with them to see. I don't know if that answered your question.
No, I think it does, yeah. And I hope if anyone listens to this that, says, oh yeah, that could be us, that they get in touch.
And let us know.
What would be your advice to a young Namibian entrepreneur today?
I think passion, if you see a need out there, it's not going to be solved by itself. If you find a solution yourself, be passionate about it and work for it. A friend of mine used to always tell me that life of an entrepreneur is actually really difficult, but I think it's very worthwhile. So, I can only just encourage you that's what the world needs, is more small business, small entrepreneurs to really solve our issues and improve our society. So be passionate about what you see and the solution that you feel is there, and just keep learning. I've just started my business MBA as well now, so I just keep learning as well.
I think I'll just add on to what she said, be passionate about what you're doing and keep pushing. I mean, of course, being an entrepreneur is difficult. Starting off something from scratch is quite difficult. So just keep pushing and stay positive. It's not easy, but keep going.
Thank you so much for sharing.
Thank you.